Hi, this is Debbie. Hi, anybody else on the call?
Hi, this is Julie.
Hey, Julie. Okay, is Jonathan going to be on the call?
No, he's out of the office today.
Okay. One thing I was going to bring up, too, is I know you sent the newsletter out last Thursday, which was great. I'm also wondering about if I thought we had said we were going to send out a reminder like just the day before. Because I don't know. I mean, a week before, a lot happens in a week. And I know it's always the third Thursday, but I just think if we had maybe a reminder like the day before, that might be helpful.
Yes, and I know that we had discussed that as well. So that was on me not getting that set up in time for this month.
It's okay. I just think we're going to need to do that just to keep everyone engaged, really. And did you want to try to use? I didn't get back to you on that email list, and I know you said you update that in January. Do you want to use a little time Friday on our call to maybe touch base on that too?
Yeah, that would be great. And I think another good idea would to make those reminders a little bit more engaging in maybe just outlining the agenda for the upcoming meeting and maybe highlighting who might be presenting.
Okay.
To have that information and reminders too.
For each month.
Yep. Yeah.
Well, I have a standing agenda that I follow. And, we might make it kind of more fun. Like this is your opportunity to share a best practice, to introduce yourself, to introduce your facility, to write a little paragraph and get it out there to everyone so people know who you are and what you're doing.
Yeah. And maybe another consideration would be, would you want people to register to attend?
You know what, Julie? That is a great idea. Bring that up. Hopefully we'll have some people on the call. I think Keith Chartier, because, I'm working at Health Services Advisory Group now, the QAO. So I talked to him, and he's going to give me time, during the workday for these meetings, which is really nice. So he did accept this invitation, but he's in California, so I'm not sure if he's going to call in today.
Okay.
And we have our board meeting scheduled for next weekend.
Mm-hmm.
But I think registering for these calls, I think that's an excellent idea because it kind of forces people to make a commitment, which I think is a good idea.
Yeah, and it kind of, formalizes the process as well.
So, yeah.
It just becomes a little bit more official and all that.
That's a good idea. It's a little different than a calendar invite.
Mm-hmm.
Okay. All righty. The other thing I was thinking is maybe we should, a couple things on the, I don't know if it would be the newsletter or what you were talking about, like a kind of an agenda that gets sent out, is maybe having a message from the board, because with this, meeting that we're having next weekend with the bylaws and stuff, it'd be nice if maybe, every month or, whatever, a board member, we could have like a message from the board, something, hey, here's what, keep that connection.
Yeah, I think that would be great.
Yeah. It wouldn't have to be real long, just saying, highlights. For example, in February, it could be highlights from the initial board meeting or something from like that.
Mm-hmm.
Okay. Oh, we could title it "Not to Board You," but I don't know if they get that. That would be cute. But you might want to know this. I mean, if we can come up with little fun things like that, that maybe get people's attention, that might work. And thank you for sending the Zoom. Now, you also sent a Zoom for a check-in. Now, is that for them to just make sure that their system is working?
I think the check-in was
U.N.I.T.E.org. Did you? Yeah,
that was for for our check-in with Jonathan and me to kind of review for Friday.
Okay, so that wasn't, okay, so I don't need to do anything with that.
You would use that
So
information.
You sent me the join Zoom meeting part 1, and then you sent me the join Zoom meeting part 2. I forwarded both of those to Val Crail and Melissa Heflin because neither one of them can attend in person. But then you sent me U.N.I.T.E check-in meeting.
Yeah, so the 2 that says part 1, part 2, those are for the meeting on Saturday.
Right.
For Val and Melissa.
Okay.
And then the 3rd one is for the KI check-in.
Oh, so you guys you have a separate link.
Mm-hmm. Yeah.
Oh, I see. Okay. So is that, do they need that meeting number then, that 408-638-0968? Do they need that?
Yeah, if they're going to use sound through their computer speakers, they just need the link. If they're going to call in, they're going to need the phone number.
Okay, and that phone number wasn't on the previous email.
The meeting invite, right now as it stands, it has the phone number that they'll need to dial in. Okay. And that's really all they need. If they use the link, it will give them the same phone number. But so on site, you'll also need to dial in.
Oh, okay.
For them to be able to hear what's happening in the meeting.
Okay, yeah. I see. I'm going to get that on my calendar so I don't miss that. Okay. So on site, I'm going to dial the 408-638-0968. Okay. And then have the 226-099. 226, what was it? 226-099-147. Okay. All righty. Okay. All right. So I have to dial into once I get to the meeting room on Saturday?
Exactly.
Okay. She said something about she's going to have computer screens like just on the table, and I know she has internet, so I could use that Zoom link and, probably project it on the screen, just for Zoom for Val and Melissa. But who knows? I mean, they might just decide to call in and not use the Zoom link, so I don't know what they're going to do. It depends probably where they are and how their internet is,
Yeah, well, the thing with the Zoom is that it has video. So if there's a video attached to the computer screens in the meeting room, Val and them could be able to see you guys meet. And then if they also have video camera, then you could see them too.
Right. So and I'm going to I'm going to send those Zoom links also to our facilitator, that, with Susan White, and just let her know that this is what we're doing. So, she's aware of it too.
Okay.
So she can know, and then for the phone to have the call in. I just think that a regular phone with a speaker is better than these cell phones are okay, but not for like a really big group. So, I mean, it's not going to be a huge group. I think we have, if Val and Melissa aren't there, I think we're going to have like 9.
Okay.
8 or 9, I think. It's either 8 or 9 we're going to have, plus the facilitator. So, is anybody else on the call? I don't know, Julie. I mean, it's 12:12. Do you want to just end the call and then we'll just have to meet on Friday? I don't want to waste your time. I'm not sure. It's kind of disappointing, But occasionally this happens where we just don't, for whatever reason, don't seem to get anyone to call in. I know we had our steering meeting on Monday, and I know Val and, you were on that call. And I did mention that we had today's call, so. The only thing I can say is I think we need some kind of reminder the day before, and I think asking them to register and formalize the process, that's probably a really good idea. And I can bring that up, And I think sometimes having a speaker too. I'm going to see if I can get Larry at NICOA to be our February speaker. Sometimes that helps too. But I get concerned if I ask like a national speaker to be on the call and then nobody calls in. That's I don't want to do that either. But sometimes if you have a more high profile speaker, people tend to call in. So
yeah. Well, and another thing that we could kind of frame it is that even if we have a low attendance for a week where there is a speaker, we can just gently remind the speaker that, and others, that, the call is being recorded so that it becomes more of an archive conversation. And so it's not just, speaking to the wind, their presentation will be captured and can be sent out to, those that didn't attend. So even if the call itself has low numbers, it could be used again and again, the information that they're sharing.
Well, that's true. And I noticed, I logged on to CMS.gov before I came over here, and I noticed we're a little behind on the recording on the calls. And also on the webinars, it looked like it was just 2015 and 2016. I didn't see, at least on our U.N.I.T.E site, I didn't see the ones we did in 2017 or 2018 on there.
Yeah, we're having...
I also wanted to update on best practice report on trauma-informed care.
Right. There's a bit of a backlog on KI's ability to update the TAC website at the moment, so that's why you're seeing no new updates.
Okay, because of the government shutdown or just other things?
Other things.
Okay.
Sure, Jonathan can provide more detail about that.
Trauma-informed care. So where are we in doing the next? Because we got to get in 3 more best practice reports.
Right. And that's what we were hoping to cover on Friday, is to iron out those topics.
Oh, okay. Okay, that's fine. And set some date for, we need to have the PowerPoint by this date, and I think we need to set that out. Yeah. Okay.
Yes. Yep.
Okay. And there's nothing, we've used speakers before that aren't in the collaborative. Like we used Dr. Henderson from Alaska. So, we have some speakers available to us that honestly could be part of our, presentation on trauma-informed care. Like I worked on the fall symposium for the Arizona Geriatric Society here in Phoenix back in late November, early December, and we used the Arizona Trauma Institute and Dr. Logan and Dr. What's his name? Spacing on his name, but they're pretty well known nationally, and they're very involved in the Arizona's initiative on trauma-informed care. So, if I could get one of them to be one of the panelists and just help us kind of understand it, and then we could pitch in our collaborative more from how do we make this happen, within our tribal nursing home. I think that could be very attractive. Now, are you okay is that okay? I mean, as far as speakers that's non-tribal or not necessarily part of U.N.I.T E.
I think that's absolutely fine, Debbie. I mean, it's really just whatever, you're so, what would be good for the collaborative, what information would be helpful to the group. So if that's, the way you want to kind of position it, that sounds fine to me.
Okay. All righty. And I'd like to get Susan Poirier involved. I know she's coming for the board meeting, which is really good. She's the one that let's do the new one, and maybe have her. I'd really, when we talk about the younger residents and addictions and disabilities, I think it'd be really good to maybe have that gal that we had on the call last month speak, about just some of the rehab perspectives, in terms of care, but then have some of the nursing homes that are dealing with this actually talk about, some of the difficulties with that,
Yeah, I think that would be great.
Any initiatives they're doing to accommodate, you're supposed to be doing person-centered care. Well, this comes up with the opioid use too. How do you, if you have someone who's used drugs their whole life or, how do we deal with it? How do we make sure we're giving them the best possible care, but also not, trying to meet the metrics for, some of these other initiatives.
Yeah.
Kind of that old balance of what's good for them versus, what they want, right? I mean, you want to listen to them and help, but then let's say they just want to do something that's not, harmful to themselves. I mean, that was always something that staff seemed to really struggle with, and then if you go too far one way, they'd be like, well, the staff would kind of throw up their hands like, well, and, then just let them do whatever they want. It's like, well, it's like there's a balance there, right? Where you're trying to help people. And I think that's where, one thing that might be a good topic to look at with our trauma-informed care, and I'm not saying I'm an expert at this, but I could certainly find someone who is, and that's motivational interviewing. That we may want to do a best practice paper on, incorporating that into your processes.
Yeah, that sounds like that would be interesting.
Mm-hmm. So we could even do a quick little survey to see if anyone's using it or even knows what it is, do a little blurb on it, and then try to, maybe interview some experts even on it, get a little expert information. I don't know if Cynthia LeCown, if ACL or anyone would know, have like a rep, an expert on this, but stuff like that, I think we need to look at, like, how do we communicate in ways that get the results that we want? You know what I mean? Like that,
Yeah. No,
we're not kind of working against them, if they're trying to improve.
Mm-hmm.
Then if the messaging is not good, you're not getting what you want. You're kind of like, well, we're not making any progress here. And, you got to ask yourself why. What is the messaging? How are you communicating? I mean, there's, how that is. There's ways of saying everything, right? You can go in a room and just order someone to do something, or you can go in a room and try to find out, what their priorities are for that day, right? Is there some common ground we can find here that your priority and my priority kind of come together? Oh, okay, let's work on that then, because I got to do that too. As opposed to just we're going to do it my way and this is how it is, because it just never get good results with that. So there might be some opportunities with the best practice report, with trauma-informed care for something like that. Maybe some of the series could finish out with motivational interviewing, communications and messaging, some things like that.
Okay.
I know it's just a written report because I think our webinar, we said we'd do our non-clinical topic or our clinical and non-clinical topics, so we'll probably have to stay with that. But I think it'd be interesting to interview some people, get their feedback, and then maybe do a little survey and say if the tribal nursing home surveyed, 8 out of 10 of them are using these things to help, even some of the questions you asked, I had that list, even some of those questions you asked the first time around, because you had a small group, but we could ask that to all the nursing homes, but maybe just pick one, right? Can you explain the types of trauma your residents have experienced? And, can you just a statement or two on walking us through your approach, right, to people who have had, like, if they've had this trauma, what would be your approach? And see if we could glean some, like kind of delve into those a little deeper. You know what I mean? Maybe pick one or two from the first report and delve into them just a little bit deeper. And we could use this. It'd be interesting to go back to the same people. You interviewed, 4 or 5?
Was we interviewed, I believe it was 4, 2 from the same facility and then 2 others.
I mean, it would be interesting to go back to those 4 people, get them to do it again. But say we're basically going back to maybe 2 of these questions that you answered, but we want to get a little more granular, a little more specific, and then maybe add each report, like try to get maybe 2 more people. Like I know Joseph had sent us a couple from Laguna Rainbow. We've got several people that have been referred to us, like Kathy Correa, or what was his name, Phil Nixon or Nick. So we've got some new people, and maybe there's a new ombudsman in Alaska. Just some new people, the ones that were from that new facility that opened up. Reach back out to them and say, we're doing our second trauma-informed care report, and we're just trying to add a couple people to the 4 we already have. And if you reach back to the 4 and said, would you be willing to do this 3 more times, and we had dates to give them, right? Like, we need to interview you by blah, and then we just keep working off that list, but just get a little more granular every time. I think there's some benefit to that because it makes them think a little bit too. Because if they say, well, we're not really doing that, you could say, well, what can you think of some, ways that you could do that? You know what I mean? Kind of get them to think a little bit. Like, and if you did that, what do you think the outcomes would be? And just kind of prompt them. You know what I mean? If you're not doing it, why aren't you? Like, how come, what makes it difficult to take that on? Is it that the staff just they don't see the importance of it? Is it that you're afraid to try something new because you don't get leadership support? Is it because, you think the residents would look at you like you're off your rocker? What is going on? Because I think that's the kind of information we need to unearth to really help with this process,
Yeah, I agree. I think that would be very interesting to take a deeper dive into
some keep adding. So if you did it 3 more times, you added 2 people each time, you could have 10 people by the last report, which is pretty significant. I mean, I just saw a national report that came out with on caregiving, and they only looked at, I think there were 5 people in the study. I'm like, really? We're putting this out to the country as best practice when 5 people were involved. To me, that's wow. So, I mean, if we could get 10 people and get a pretty, granular interview where they're really opening up and you're really getting some good stuff, I mean, that could be a really nice final report for that topic.
Yeah.
And that kind of follows that idea of it's a series we're building. We're taking the same 4 people, but we're adding every time. We're trying to get 2 more people, and I think we could do it. I think we could definitely do it. And then it wouldn't be so hard because you're not recruiting 4 more people every single time. You're just getting 2 more, and get the 4 people to commit that you already interviewed.
Okay.
I think that might actually work really well. So, okay, Julie, anything else? I thought the newsletter looked good. We just got to try to get some of these nursing homes to send us some pictures. They're just like a little paragraph, just nothing big,
Yeah, I wonder if we could, because we're waiting for people to send us stuff. So I'm wondering if we did a little probing and just maybe ask a couple people directly to send us something, kind of like what you did with Val, where you're like, Val, can you send us something?
Right.
It just makes it more likely that someone will.
Do a webinar for you.
Yeah, I'd like that.
I was waiting for my thank you note from you. I'm just kidding. But, I think that, what? Okay, so when we redo the email list, let's think about this. You alphabetize it, right? And then we'll just go through, okay, we're going to reach out to the A's in January, or A through the C's in January, and the DEFs in February, and just schedule it. And reach out to all those people that are, hey, we're so glad you're keeping up with U.N.I.T.E, and you get your monthly newsletter. Isn't that great? And we know you can't always make the calls, but would you please send us a picture about your program, and we'll make sure that it gets in the U.N.I.T.E newsletter. So if it's anything to do with aging or long-term support services, we'd love to showcase you in our newsletter. Something like that, maybe?
Mm-hmm. Yep.
So you're not emailing everyone every month because, who knows, but you could do like a alphabetical, reach out.
Yeah, that sounds like a pretty manageable approach.
Yeah, just ask, and you can put my name on it or whoever. Just say, the board would, really like to hear from you, and we're trying to make our newsletter more just fun and informative, and we'd like to hear what you're doing out there. Because that alone, stimulates a lot of conversation because people bring up, just when you're talking at work and someone gives an acronym, you're like, I don't know, who's that? Like, I've never heard of that, And then you go on their website and you're just like, oh, wow, like I didn't know that even existed, right? And so the more you listen to webinars or have these meetings, people bring up stuff and you're just like, oh, I have no clue what that's about. So I think that's a real benefit. Plus, if you're trying to get your program noticed, it certainly is basically free advertising. How many people now? How many do we send it out to? About 60, or is it more than that?
Oh, I'll have to do a quick check on that.
Okay. Well, we can talk
Pull
on
it up
Friday.
really quick.
I do have a 5:15 appointment, so I'll have to get off right at 5 because I'm going to have to head out the door, but I'll have an hour. So.
Okay.
I mean, we may want to put that and say the U.N.I.T.E newsletter goes out to 75 tribal entities all involved in long-term support services. So, this is something that, just a free way to get your word, get your information out there. And then I don't know if you're familiar are you familiar with the Lifeline program for low-income Native and tribal consumers? Have you heard of that?
No.
Okay. It got sent to me, and I just wondered I was just curious if you had ever heard about it. It's run by the Universal Service Administrative Company. I don't know if you've ever heard of that. It's like provides reduced rates for telecom services to eligible low-income communities. So I just wondered if you had heard about it.
Mm-hmm. Okay. No.
All right. I'm thinking it would be like for elders living out in their home, right, that needed help paying their bills so they could have some kind of lifeline, if they want to be at home. So. All right. Well, Julie, I guess that's about it. I don't know, is there anything else before Friday that you need me to do?
Nope, not really. I think we'll have a pretty good discussion. I'm going to type up a list of, things that we already have kind of in place, and then I'll send it to you so we can kind of just talk through it all. Yeah,
that would be good. I lose track of everything I say, so hopefully you don't lose track of everything I say. But I will send to Susan White because we're using her office on Saturday, so she'll know kind of what we're doing. And then I'll make sure that Val and Melissa notice that number too, that's the phone number and the password. And, they can either use the Zoom link and go off their computer, or they can call in with that number. So.
Okay.
And if they're driving or something, they might just want to call in. But
right. So for the U.N.I.T.E email list, there are 76 people.
Right. Okay. There you go. So I mean, that's a good amount. And we can say that they are. We currently reach out every month to 76 different people, and it's a growing list. And please spread the word. Ask people to, link. Now, are we putting these newsletters on the CMS.gov website where everything else is, or could we?
We could. We just we hadn't set that up yet. I don't think that had come up as a thing. So we could put that on our list as something to look towards, because I think that's a good idea in a newsletter archive.
Yeah, I think we should do that, because I know I've signed up for a whole bunch of getting government emails, and then a lot of these different places also have would you like our newsletter brought right to your inbox. So it's a decent, what we're sending out is decent, and we're putting good resources on there. And so I think, really, and I could probably I know the QIOs have put out resources, and I'm going to make a note. I'm going to ask Keith if he has any recommendations for free resources that I could add to the U.N.I.T.E list,
Okay.
Because I'm sure they've got a ton of them. And then that way we can, put some of those out there in the newsletter. But then, if we can link, get when people go to CMS.gov, you just say, hey, all our newsletters are there, and all those free resources are there. Just click on them and look through them and see what looks good to you. And that way, too, if you're trying to encourage people to send pictures or write up a little one-page summary of their facility, and we might have to edit it, but then it's like, hey, that's going to stay on the CMS.gov website. That's not just going to be one time and then everyone forgets about it. There's actually a place where that's going to be housed, so that kind of makes it, I think, a little more special too. But
Okay. Well, It sounds like there's a lot going on here.
Well, there is. It's exciting.
It is. No, I like it. It's all very good.
I think it's going to be good. And once we get our bylaws and support in place and stuff, and, hopefully people will, stay committed. I know it's a little hard to do at long distance, but it's not impossible. You just have to do your work off site. You have to at least be on the call. To me, that's like minimal. You have to at least be on a call once a month, at least to hear what's going on, even if you don't contribute in a lot of other ways. Go back to your facility and say, hey, did you all know there was this group called U.N.I.T.E? And, there's a call once a month. And if I can't be on it, would you be willing to be on it? And, it's all about, best practices and education and networking and advocacy. And it's really good. And you got to build it up. You got to talk it up a little bit, So, maybe I'll bring that up on our next call.
Yeah, I think so too. And
I'll write just a little article for the February newsletter and just keep it real positive, but say, why is it important to call in, or the importance of calling in, something like that.
Yeah, I think that would be great. And I think the more steps that we take to make this a formal meeting, I think the better. I mean, I think we've already established the reliability and consistency, because it is just taken place every month for, the past, 3 or 4 years. So
Right. More than that, honestly, I think it's been 4 years, or is it 5 years? It's been a while.
It's been a long time. Yeah. So I think we're making the way there, and I am pretty excited about where it's heading too. So will this February meeting?
I think we have excellent support, not only from you, from CMS, from ACL, from the QIOs, from the Ombudsman. We have good support. We just need to get the tribes on board, and get the facilities on board. Okay. All right, Julie, I'll write a little paragraph. I'll try to come up with a catchy title, and you can edit it as you see fit, but I'll try to just say, hey, why is it so important that we all at least minimally call in? Why is that so critical?
Yeah, that would be perfect.
Okay, I'll do that. I can do that. And you need that by what? What was the Wednesday deadline? February 4th or something?
February 6th.
Okay. All right, I can do that. Send me if you don't get it by that Monday of that week, please just send me a quick email. Say, Debbie, don't forget to send that paragraph, just in case. I'll put it on my calendar. I'm pretty good, but just in case, because I just started a new job, so I'm kind of overwhelmed with everything else. You know how that goes.
Yes. Yep. I understand. That sounds good.
All right. All righty. Thank you so much.
All right, and we'll talk tomorrow.
Yes, I will be at my house, and I'm calling you, right? Did you send me a call-in number, or we're just calling into this number?
No, I created a calendar invite using Zoom.
Oh, you did? Did you send me that?
Yes, that was to your...
Did you send it to U.N.I.T.E Native or to my Gmail?
To U.N.I.T.E Native.
Oh, okay. Let me double...
Do you want me to forward it to your Gmail?
Oh, no. Wait. That was the check-in meeting. Oh, okay. That's what I was trying to understand. I thought that was something for Val and Melissa. That's what I was trying to figure out. Okay. No.
Oh, okay. Sorry. Yeah,
that
subject line was a little vague. Could have added AI in there.
Accepted. Now I see what's going on. Okay. That was the one for the check-in meeting. I was like, what's the check-in meeting? Okay. All right. I'm going to say add to calendar. Okay. Do I need to accept this? I don't see a place to accept.
At the very least, just make sure you have access to the phone number so you can call in.
Yeah, let me double check. I just put it on my calendar, so let me just double check that it's on my Google Calendar.
Okay. And have you used Zoom before?
I have the app. I have the app on my phone. And I don't... Okay. I can go to Zoom.com, right?
I believe so.
No, it should be fine on my computer at home, but if not, if worse comes to worse, I have to Zoom out. Because William, remember William at our facility, our IT guy, he set me up with Zoom. I did a couple of Zoom trainings, so he's the one that had kind of set me up on that when I had my iPad. Wait, hold on. Where's my Google Calendar? Thank goodness I had William there all those years. Man, he taught me so much. He was a real blessing during those years because there was a lot of stuff I didn't understand. All right, well, I might need to download it. I don't know why I don't see it here. I thought I had it on here. I'm sure it saved it. I'm not worried. Okay, so we should be fine.
Okay.
All right, I'll talk to you tomorrow. Thank you so much, Julie.
All right. Have a good one.
Okay. All righty. Bye-bye.
Bye.